to welcome Dr. Nick Gilpin, one of our famous infectious disease specialists at Beaumont. You may have seen Dr. Gilpin on local and national television as he's been discussing how Beaumont and Michigan are working our way through the pandemic. Hi, Nick. Thanks for joining us. Really appreciate your extraordinary efforts ever since the pandemic broke. I remember seeing you over at Grosse Pointe. I think it was on April 4th or 5th. It was a Saturday when Grosse Pointe was up to about 85% COVID patients. And this is April of 2020. This has been a long road. But, what do the recent loosening of mask restrictions mean for our team members here at Beaumont from your perspective?
Well, thanks for having me on first, John, and I appreciate your leadership during this time as well. This has definitely been a tough year. To your question about the recent changes on the mask restrictions, the short answer is I don't think a whole lot changes for us right now as a healthcare system. And for starters, that's what we are. We're a hospital or a healthcare system, and we have an obligation to keep ourselves and our patients safe, by any means necessary. What I think these guidelines reflect is the fact that we know that these vaccines are incredibly effective at doing what they're supposed to do, that is stopping COVID disease. And even now we have some information that they also stop COVID transmission to a large extent. But the caveat is that in our area in Southeast Michigan, we are still seeing quite a bit of COVID activity. We have test positivity rates in the 6 to 10% range. And we also don't always have the luxury of knowing who's vaccinated and who's not right now, even sometimes among our own teams. And among those who are vaccinated, we don't always know who may have certain risk factors that may make the vaccine less effective. For instance, who may have a compromised immune system. So bottom line, John, I view these guidelines as an acknowledgement from the CDC that the vaccines do work and they are effective. But I think we still have a long way to go in terms of getting more people, including our own team, fully vaccinated.
With last week's announcements of lifting some of the mask requirements, why should people still get vaccinated? What would you tell somebody in an elevator speech of why it's critically important still?
The science shows that the risk of getting COVID, particularly severe COVID disease, is microscopically low among people who are fully vaccinated. And recent publications have also shown that the risk of asymptomatic transmission among people who are fully vaccinated, and that means contagiousness among people who are fully vaccinated, is extremely low. So if you're fully vaccinated, your risk of getting COVID or spreading it to others is extremely low. And that's good news for you. That's good news for the people in your life. That's good news for the patients that you take care of, your coworkers, your family, your friends, and everybody.
What is the current information on the success of the current portfolio of vaccines in handling these new variants that are appearing around the globe?
There are three predominant variants circulating in the US. There's B.1.1.7, which is the UK variant, which is the one that lives mostly in our backyard and throughout the United States. There's B.1.351, which originated in South Africa. And there's P1, which originated in Brazil. And when you look at the data that's available, and to be fair, we are lacking in some real robust data, but the data that we have available does indicate that these vaccines are effective. Now, they may have slightly diminished effectiveness, but even that slightly diminished effectiveness means that the vaccines are still doing a good job at preventing COVID disease. Now, there's a new variant that's starting to emerge, and it's coming from India. It's the B.1.617 variant. And this has been labeled a variant of concern, and we have to keep an eye on this one. But so far, even the data that we have available here shows that, yes, this variant is more transmissible and perhaps even more deadly, but the vaccine does seem to have good stopping power, even against this variant as well.
A question I get a lot around the system is, what is your advice for families where the adults are vaccinated, but they have young children in the house who aren't vaccinated yet? And what's safe for them? What's the best way to protect the children?
We know the vaccines are now available for anyone over the age of 12. And I would very much endorse anyone who's in that age range, go and get your vaccine. But for those children under the age of 12 who don't yet have the opportunity to get vaccinated, the CDC advises that if you're between age 2 and 12, you should still wear masks when you're in public and when you're around people who don't live in your household. Now, for parents who are vaccinated, it's okay for you to not wear a mask in public, as per CDC recommendations, as long as everyone in your family is considered low risk. So if you have a child in your household who's unvaccinated, who it may have a compromised immune system, I think you need to make sure you continue to take precautions. As we speak, all of the vaccine manufacturers, Johnson & Johnson, Moderna, and Pfizer, are all actively participating in studies to enroll children under the age of 12, even as young as 6 months old. So we are going to get more data on this soon, and we will hopefully have some recommendations soon to include those under 12-year-old kids and getting them vaccinated as quickly as possible.
Well, I think my kids will be glad to hear that with my grandchildren, so that's great news. And Nick, I want to thank you again for your time today. Thank you for all you've done during this pandemic. Infectious disease specialists like yourself are certainly rock stars right now, and we look forward to seeing you again on local and national media. You do a great job for Beaumont, but most importantly, you carry the right message that people need to hear to manage their way through the pandemic. So thank you very much.
Honored to be here, John. Thank you.